Thread lifts are a procedure that involves the insertion of literally threads into the face or the body. These threads can be either permanent or resorbable in nature. So permanent ones mean they'll never go away, although the result still lasts years rather than forever. And resorbable mean they're gradually broken down by the body. As far as non-surgical treatments go, these are probably about as invasive as it gets, and any practice performing these procedures does need to be registered with the Care Quality Commission because it is classed as a minor surgical procedure. Even though you're not having any knives, you're having relatively large needle holes that then create a little space for you to have the threads inserted. And there are different types of threads. There are PDO threads, polydioxane, which are about collagen stimulation, and they often have little barbs along the length that can give some sort of lifting effect. Or they can be what we call suspension sutures. So this is something like Silhouette Soft, which will stimulate collagen, but usually they have something like little cones along the length that provide some tissue suspension and lift. For me, these procedures are, as I mentioned, about as invasive as it gets. I've performed many over the years, but choose not to now. The way thread lifts work is potentially through two different mechanisms, maybe three even. One is when a thread has barbs along the length. These barbs can hook into your tissue and provide some sort of tissue elevation, as well as collagen stimulation. PDO threads can also just be these very fine threads with no barbs along the length, which are inserted more superficially to give collagen stimulation. So they are just about providing some sort of surface tightening maybe. And then you have the suspension sutures, which are designed to reposition soft tissues of the face. And these will often have things like little cones along the length. Again, those cones are anchoring against the facial tissues to give some form of lift. As you can imagine, when we're using essentially strings, threads, to get this right requires an immense amount of expertise and skill. And there are many people for whom the procedure isn't suitable. For example, anyone with very little facial fat or a lot of skin laxity won't get a good result, and equally someone with a very heavy face will be underwhelmed by the result they achieve. When it comes to safety and side effects, they can be minimized by being in the hands of a good practitioner, but even in the hands of skilled and experienced doctors, they still carry a higher risk than other non-surgical procedures like facial fillers, for example. And we know this from an audit of the members of the British College of Aesthetic Medicine, where that data has been consistent over the last few years. The most common side effects by far are discomfort after the procedure, that you can be quite sore and tight. Bruising is likely rather than possible. Swelling, so you can be visibly quite swollen after the procedure. And then it's quite common to get some sort of puckering or dimpling. Excessive puckering or dimpling is a sign that the strings have been over tightened. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.